What is ciprofloxacin? Ciprofloxacin belongs to a class drug called quinolone antibiotics. Its alphabet name is 1-cyclopropyl, 6-fluoro-4-oxo-7-piperazine 1-quinolone 3-carboxylic acid. It used to treat bacterial infection, and it may be used orally, intravenously, as ear drops or eye drops.
Hello, Assalamualaikum. My name is Nurul Fatia and I'll be explaining about ciprofloxacin interactions with yogurt.
From the structure, the most likely stylation site or the complexation site on the ciprofloxacin molecule is the carboxylic group, which suggests that the gastric pH must be elevated for the chelation to take place.
So actually, what leads to the interactions to occur? First, we have to look at the structure of ciprofloxacin. It have the zwitterionic properties that were contributed by these two functional groups, which is first the carboxylic acid in the third position, and also the basic piperazine ring or another N-heterocycle at seventh position. So these zwitterionic properties will attract the calcium ion that is positively charged to bind with the CPFX structure, thus making an interactions that we call as complexation of metal ions or the chelation of the metal ions towards this drug. So the complexation interactions of the calcium ion with the ciprofloxacin structure actually alter the original properties of CPFX drug that is soluble and can pass through easily the semi-permeable cell membrane in our body. And after the complexation occur, the properties did change and it cannot pass the cell membrane easily, and it interrupts the absorption of this drug inside our body, especially at our small intestine. So the knowledge about the interactions of CPFX with the calcium ions inside the yogurt is such a crucial knowledge that people, especially who took these medications, to know, because the interactions or the concomitant ingestion between this food and drug will affect the solubility, the pharmacokinetics, the bioavailability, and also the mechanism of actions of this drug inside our body that will affect the absorption of this drug and also affect the efficacy of this drug.
From the graph and the table shown, the concomitant ingestion of 300 ml milk or yogurt with 500 mg ciprofloxacin can significantly reduce both the rate and extent of ciprofloxacin absorption.
Hi, for my part, I will talk about ciprofloxacin interact with calcium fortified orange juice. Okay, what is calcium fortified orange juice? It is an orange juice that contains calcium that called calcium citrate malt. It is a water-soluble calcium, and when dissolved, it will release calcium ion and calcium citrate complex. And this formulation will provide optimal calcium absorption. Interaction and effect of ciprofloxacin with calcium fortified orange juice will reduce the effectiveness of ciprofloxacin. It will inhibit the intestinal transport, increase the gastric acidity, and all of this will have an effect to the body. Calcium fortified orange juice can reduce the effectiveness of ciprofloxacin, and a study stated that the rate will decrease by 41%. PGP and OATP can reduce the absorption of ciprofloxacin. This is because OATP and PGP can bind with ciprofloxacin, thus it can decrease the absorption of ciprofloxacin in the body. When gastric acidity increases, the bioavailability of ciprofloxacin will decrease, thus the effectiveness of ciprofloxacin will also decrease. Lead to bacterial resistance and lack of eradication. This bacterial resistance can threaten the ability to treat common infectious disease and make it harder to treat because antibiotic will become less effective.
Hi, my name is Nur Farhanis and I will be explaining about ciprofloxacin interaction with coffee. Coffee is one of the most known beverages which have a pharmacokinetic interaction with many drugs. One of them is ciprofloxacin. Most known bioactive component of coffee is caffeine, and it has its own chemical structure like shown in the picture. There are three types of interaction that involve in coffee with ciprofloxacin, where first is form complex formation. For complex formation is where caffeine will interact with ciprofloxacin by dipole-dipole force or hydrogen bonding between the polarized carbonyl group of caffeine and the hydrogen atom of ciprofloxacin. And the effect will reduce the ciprofloxacin absorption in body by gastrointestinal tract, and the risk of ciprotic failure will increase. As for lowering metabolism of ciprofloxacin, metabolism itself will make the ciprofloxacin more water soluble. Taking ciprofloxacin with coffee will make the caffeine in coffee inhibit the metabolism enzyme of the ciprofloxacin, and it will reduce the ciprofloxacin absorption in the body, and the risk of hepatic failure will be increased. Lastly, is decrease the absorption of caffeine, where ciprofloxacin will decrease the elimination of caffeine from the body by inhibit the enzyme that is responsible of metabolism of the caffeine, and it will cause the caffeine blood level increase in the body, and it can lead the increasing of effect of the caffeine such as headache, nervousness, insomnia, and so on.
Next, the ciprofloxacin interaction with milk. Milk is the one of calcium sources, and in the milk there is a casein as the main type of protein, and in the milk the casein and the calcium affect the absorption of CPFX. Next, in the interaction between CPFX and milk, the calcium in the milk bind with CPFX, preventing its absorption and reducing its bioavailability. Because the physiochemical interaction between CPFX and the milk matrix will resulting in decrease in the amount of free CPFX due to the complexation with metal ion present in the milk and the absorption at the surface of protein component. Next, for the side effect, as dairy products appear to influence ciprofloxacin absorption in the gastrointestinal tract, so it will lead to diarrhea. And oftenly, patients may struggle with yogurt to help them swallow the tablet, which can lead to calcium drug complexes and decrease the bioavailability.
Hi, my name is Nur Aisha, and I will be explaining about ciprofloxacin interaction with alcohol, which is ethanol.
What is alcohol? Alcohol is a clear and volatile liquid that has a pungent and bitter taste produced from the natural fermentation of sugar. The ethanol, also known as ethyl alcohol, is the form of alcohol that contained in beverages such as beer, wine, and liquor. Interaction of ciprofloxacin with ethanol. There is specific inhibition of CYP1A2 activity. In addition, ciprofloxacin decreases cytochrome CYP3A4 mediated biotransformation, but it does not inhibit the metabolism of substrate that are specific for the CYP2E1 and CYP4A1 isoenzyme. The isoenzyme CYP2E1 is the major contributor to the MEOS in the human. Thus, the inhibitory effect of ciprofloxacin on the ethanol elimination rate could at least partly be the consequence of the drug's interference with cytochrome-mediated ethanol oxidation.
This graph shows the study about rate of ethanol that decreased after the treatment with ciprofloxacin.